Okay, so here's the question. As the weather begins to cool down, those aches and pains, do they seem to flare up a little bit? Why is that? Is it all up here, or is it actually happening? Joining us this morning, Trinity Health Orthopedic Surgeon, Trinity Health IHA, Dr. Ben Harper. Doctor, thank you for coming in.
My pleasure.
We appreciate you. I know you're busy performing a lot of surgeries, but let's back up a step and talk about, do things hurt more when we start to get colder weather?
A lot of times they do. You know, there's fair evidence that with barometric pressure changes, arthritis or achy joints seem to get a little more bothersome.
Okay, so that is legit. At what point, well, when do you treat something with just some ibuprofen when something starts to hurt?
Sure. You know, I think either Tylenol or ibuprofen, and different people's medical background feeds into that. You know, their doctor may have told them if you have liver problems to watch out for Tylenol, or kidney issues to watch out for ibuprofen, but generally those are very reasonable. And I would say a lot of us have a little overuse injuries, and a few weeks of ibuprofen settles that down, and that's fine.
But you don't want to, for a lifetime, be taking ibuprofen.
Right.
So after a few weeks, if things still hurt, you see the doctor.
Right.
What are the steps before you get to surgery?
You know, I think it depends on what's going on, and I see a lot of people, and they, you know, if we get to a certain age and our knee hurts, we assume it's arthritis, and it may well be, but there are a lot of other things that can bother knees as well. I mean, there are tendonitis issues, there are overuse injuries, there are deconditioning, and there's arthritis and meniscal stuff too.
All right, so I'm going to grab this knee here just to show everybody at home. So when things start to really hurt between here, I know people get shots sometimes.
Sure.
Basically, this is wearing down, right, and it turns into bone on bone. But you can do physical therapy. Sure. There are shots that you can get. What are those things doing? Are they helping to repair?
So no, generally not repair. If you look at it, the shots are generally aimed to decrease inflammation within the knee. So part of arthritis is the wearing away of cartilage. So that's going to be the gristle on the end of the bone. So we have the femur bone and the tibia, and there will be cartilage on the end of those bones. There's also a meniscus in there, one on the inside, one on the outside, that's kind of a cartilage O-ring within there. As you look at it, the shots with cortisone injections, which are the most common shots, there are a few different options for shots, but the cortisone decreases pain and inflammation, and it's generally not healing things per se. It's settling down and acutely flared up things. They last several months for most people, but there's some variation there as well. Okay,
so when that stops working, is that when we bring out this guy here? This is the knee replacement. Really fascinating. Which way does this go, Doctor?
Yeah, so knee replacement's an option, and as we go through, we want to determine if that's the best option. But when we come to knee replacement, this is a knee replacement model, and basically a lot of people think it's a big cut, but really less than an inch of bone is removed, and there will be a cap on the end of the bone, if I can get this off, that will fit on there.
So this is your knee bone that has been kind of shaved down a little bit.
Right.
And then you glue that on top.
Right. So that goes on, and then there's a little plastic piece in there that will wear with time.
And that goes into the other end.
For sure.
And what's the success rate with joint replacements, whether it's knee, hips?
Knees and hips are a little different. Knee success rates for thrilled with their outcome is probably just south of 90%. Hips are over 90%.
So in other words, it sounds, and this may look very frightening, but you can really enjoy pain-free mobility if this is the route that you need to go with, for the most part.
A new lease on life. All
right, good stuff, Doctor. You're going to come back in our next hour, and we'll talk also about how to protect these joints, because as you can see, this is some complex stuff that the human body is doing. So yes, we'll talk more about protecting these joints and some other things, some other options.
Fantastic.
Thanks, Dr. Harper.
Thank you.
The doctor's in. We're talking about arthritis and some other things that may just be causing some aches and pains. Orthopedic surgeon Dr. Ben Harper with Trinity IHA Medical Group is here, and we're talking about when things start to hurt a little bit. What does it mean? What's going on, and what can you do about it? So, Doctor, first of all, thank you for sticking around with us this morning. What is happening and we're primarily talking about knees and hips, right? What's going on there? What could be causing that pain?
Right. So I think a lot of people as we have pain, in our own mind, we tend to come up with what we think is causing that pain, and at some age, we kind of attribute it all to arthritis. And sometimes it is, a lot of the time, in fact, but there are other things that can go on, like tendonitis concerns, overuse injuries, things like that. You know, a lot of people come in and they say, well, I thought it would get better. I gave it a few weeks. And frankly, I think that's a great idea. You know, there's not a need to come in all the time, but there are things that you can do.
Let me ask you, what is arthritis exactly?
Sure. So arthritis is a gradual wearing away of the cartilage cap on the end of the bone, and it does tend to happen, you know, later on. There are strong genetic factors that play into that.
Okay.
There are activity and environmental factors as well.
Okay, so you're wearing down that cartilage. Is there any way to get that cartilage back?
No.
No. Okay, it's not coming back.
No is the short answer.
All right, that's good. That's good. So what can you do? Because that's where you get the pain, right?
Sure. Sure. So looking at things for arthritis, like keeping active, you know, people go round and around about, you know, how much activity is good. And I think generally probably keeping active, you know, 4 days a week or so is good. Honestly, you know, keeping at a healthy weight, keeping engaged in life is good.
Let me back you up. Being active, what does that do? Are you adding blood flow to those joints, or what are you doing to protect those joints?
So there are a lot of things from general health perspectives, like cardiovascular status and things like that. But for the joint itself, like keeping the motion is important for it. One of the things that tends to happen with arthritis is that joints will get stiff, and you can counteract that by some daily stretching programs. Also, joints that are used to seeing weight and activity get more tolerant of it. So the less active we are, then when you are active, you feel it more.
Right. So it's the whole move it or lose it.
Exactly.
That's true, right?
Exactly.
Physical therapy is an option, and explain to us what does physical therapy do to help these joints recover or feel better?
Sure. So I hear a lot of people that say, well, I do my daily walk, or I go to the gym.
Yeah, I don't need physical therapy.
Right.
Yeah.
And therapy should be much more than that. Therapy is isolated on very focused things. So a lot of times, like think of a knee with arthritis, a lot of times it'll get stiff. It doesn't want to kind of go flat all the way. Well, if you walk with a knee like that, you're walking in a crouch gait all the time, which is going to overload that joint even further.
Gotcha.
So if you can get back some of that motion, it can do a ton. And honestly, therapy is probably the best solution for tendonitis issues, which is another common thing that plagues knees or hips. Perhaps not even related to arthritis. So just because we have joint pain doesn't mean it has to be from arthritis.
So understand that there could be many different things making you hurt, and there can be many different solutions. What you don't want to do is be taking over-the-counter painkillers for an extended period of time.
Correct.
Let's talk about body weight, because we know that the more every step you take, the more pressure you're putting on those joints, that can cause some real wear and tear.
For sure. And if you look, for instance, at a knee in single leg stance going downstairs sees about 7 times our body weight. So if we think about that, a lot of us carry maybe water softener salt or rock salt up and down. You put a 40-pound bag on your shoulders and, yeah, my knees hurt, but if I step back and think, so how's that affecting me day to day? It does. It makes a huge impact. And the good news is, if you look at, like, if we struggle with weight, perhaps 10 pounds of weight loss may not put us exactly where we want to be. It can be 70 pounds of weight off our knee on stairs, which can make a huge impact.
Yeah, it's amazing. Yeah, if you say, oh, I just lost a couple pounds, I still don't fit into my favorite jeans.
That's fantastic.
It's doing incredible things for your joints, right? Good information, doctor. Okay, so as we get into the winter months, anything we can do to protect these joints?
You know, I think
recognize that also cold weather, you might feel it a little more?
There are some issues with barometric pressure and joints hurting a little more. I think, you know, as we head into winter months, a lot of us tend to just be indoors and not be as active.
Right.
Being outside, you know, but watching for the icy days, slip and falls, obviously, unfortunately, happen. So watching for that, but continue to be engaged outside.
On that note, it can just be one quickie slip and fall that can really wreck you, right?
Yeah.
Oh,
yeah.
That's the scary part. That's why you have to be so careful out there, because one wrong step and sometimes you've got a whole bunch of recovery. Dr. Ben Harper, Trinity Health IHA Medical Group, thank you so much.
Thank you. I appreciate you having me.
Interesting stuff. We'll take a quick break and be right back.